Assalamualaikum and good morning to one and all. Today we'll start with part 5 of drug used in special population with reference to pregnant women. I am Professor Sheikh Abu Sufyan. Welcome you to my YouTube channel Pharma Learning Forever. At the end of this e-learning session, you are able to explain pharmacokinetic changes in pregnant women and discuss practical aspects of prescribing drugs in pregnant women and classification of teratogenic drug. So let's start with pharmacokinetic changes which are seen in case of pregnant women. Because in case of pregnancy, there is completely different physiology. Since this physiology it is changed, it also affect the pharmacokinetic parameters of the drug, including absorption, distribution, metabolism, and excretion of the drug. So let's see first what happen with absorption of the drug, and it is depend on how the stomach physiology and what exactly happen in case of pregnant women after the pregnancy. So in case of pregnant women, it was observed that the absorption of drug it is significantly affected due to few reasons. So one of the reason it is increase in the vomiting. So vomiting it is very common symptom in case of pregnant women, and most of the pregnant women during their first trimester they suffer from vomiting. Since there is increase in vomiting, in such case, if you give the oral dosage form or any drug, if you administer through oral route, then this drug administration it is almost completely impractical. Why it is impractical? Because whatever drug it is going into the stomach, it will expel out through the vomiting, isn't it? And if it is coming out through the vomiting, it will not absorb into a systemic circulation. So that is the reason why the absorption of those drugs which are given through the oral route, it is almost impractical if the pregnant woman, if she is frequently vomiting or if she is suffering from frequent vomiting, which sometimes even may not be controlled by giving the medicine. Because most of the time the giving anti-vomitic drug can be the option, but to the certain extent you cannot continuously give this anti-emetic drug. So this is one of the problem. Second problem is that in case of pregnant women, there is decrease in gastric emptying time. If gastric emptying time, if it is decreased, then drug will take more time to empty it into a small intestine. So when drug it's move from your stomach to the small intestine, that process it is called as the gastric emptying. So I am writing it as GE. So GE stand for the gastric emptying. In case of pregnant women, there is decrease in gastric emptying. What it means that drug what you have consumed, if mother is not suffering from the vomiting, then it's remain for more time in the stomach. And if it is remains for more time in the stomach, and if its site of absorption, if it is small intestine, then it won't absorb into systemic circulation, or accordingly there is delay in absorption of such drug. Okay, so decrease in gastric emptying also lead to delay in absorption of the drug which is given through oral route. Third reason is that there is decrease in small intestinal motility. If the small intestinal motility, if it is decreased, that is called as the peristaltic movement. If that is the case, then it also affect the absorption of the drug. So overall we have seen that due to pregnancy, due to three reasons, that is the vomiting, decrease in a gastric emptying, and decrease in small intestinal motility, the absorption of the drug given through oral route it is affected in case of the pregnancy. Okay, so this is about absorption. Second parameter it is the distribution. Let's see how distribution it is affected in case of pregnant women. So in pregnant women, the blood volume it is almost increased by 1/3. So the blood volume it is increased, and due to increase in a blood volume, there is increase in a distribution of specially polar drug or water soluble drug. Because what is that which increases the blood volume? It is the water. So the water in the blood, if it is increased, obviously it will increases volume of distribution of water soluble or polar drug. Okay, so this is what happen on the blood volume. Let's see what happened to total body water in case of pregnant women. So there is increase in the body water due to large extracellular volume and change in uterus as well as the breast. So the size of both uterus as well as breast, it is increased in case of the pregnancy. Also, the water content in extracellular compartment, it is increased in case of pregnancy. So overall, there is increase in body water in case of pregnancy due to hormonal changes. So this is one more reason. And when extracellular water, if it is increases, then this water will move into extracellular compartment, and due to their movement into extracellular compartment, that patient may suffer from the edema. So you may see that some of the pregnant women, I am not talking about all pregnant women, but in all pregnant women there is increase in extracellular volume of the water. There is also change in the uterus and the breast, but everyone doesn't suffer from the edema. The few of the pregnant women where there is excessive or the large amount of extracellular volume, if it is present, then those women will suffer from the edema, and it will add up to 8 liter to the volume of extracellular water. So this is another problem in case of the pregnant woman. Let's see what happened to the plasma protein, because plasma protein, it's play vital role in distribution of the drug. Since there is increase in a body water or increase in the plasma volume, obviously proportionately there is decrease in concentration of the plasma protein. And now when concentration of plasma protein, if it is decreased, it will increases the concentration of free form of the drugs which are supposed to bind to the plasma protein. So it may produce sometimes the toxic effect of those drugs which having high plasma protein binding. So to summarize, in case of distribution, the water quantity is increased in the body. Some pregnant women, they may suffer from edema. Generally up to 8 liter of water, it is getting added into entire body system, and overall result is there is increase in volume of distribution of water soluble drug. Likewise, in case due to plasma protein concentration, since it is fall, there is increase in the free concentration of those drugs which are supposed to bind to the plasma protein, or the drug which having high plasma protein binding. So this is the impact on the distribution. Let's see how it affects the metabolism. We know that in case of pregnancy, there is change in the hormone. Also, there are change in a n number of enzymes which are responsible for metabolism of the drug. So overall, metabolism, it is increased due to enzyme induction, because in case of the placenta it increases many enzymes. Since enzymes are released by the placenta, it will lead to enzyme induction. And now what happened due to enzyme induction? Due to enzyme induction, there is increase in the rate of elimination of few drugs like theophylline. So those drugs which are metabolized by the enzyme, which are induced in case of the pregnancy, their rate of elimination of those drugs, it is increased. So I have just quoted example of the theophylline. Likewise, the many drugs are there where their rate of metabolism as well as excretion, it is increased in case of pregnancy, especially due to enzyme induction. Okay, so why it is happening? Because there is increase in level of the placental enzymes which produces the metabolism of the drug, and obviously when drug it get metabolized, it will be converted into water soluble form which can be excreted into the urine, right? So this is the impact on the metabolism. Let's see what is the effect on the renal excretion. So on the renal excretion, it is observed that the renal plasma flow, it is almost double. Since the renal plasma flow, it is double because there is increase in volume of the plasma or volume of the blood, obviously the more blood will move towards the kidney, and since there is more movement of the blood towards the kidney, the renal plasma flow, it is almost double in case of pregnant women. Now what will happen due to this? Due to this, along with the blood cells and whatever which is present in the blood, there is also movement of the drug from the plasma into the kidney, right? And due to that, there is increase in the excretion of the drug which are excreted through the urine. So there is increase in a renal excretion, and obviously when there is increase in the renal excretion, it is those drugs which are purely excreted by the urine, their pharmacological action or expected effect will decrease. So the effect of the drug will decrease, which are supposed to be excreted through the kidney due to increase in renal plasma flow in case of the pregnancy. So this is effect in case of the renal excretion. So the example of the drug belong to this category are the digoxin, lithium and ampicillin. So the usual dose of the drug in case of pregnant women, due to increase in the metabolism, due to increase in the renal excretion, it may not produce desired pharmacological effect. So we have seen how the pregnancy it affect pharmacokinetic parameter right from absorption, distribution, metabolism and renal excretion. Now let's see about practical aspects of prescribing and dispensing medicine in case of the pregnancy. So when you talk about practical aspect of prescribing medicine in case of pregnant women, you must consider different stages of the pregnancy. Which stage of pregnancy it is, whether it is the stage 1, that is fertilization, or it is stage 2, that is the organogenesis, or it is stage 3, that is fetogenesis, or whether it is stage 4, that is delivery of the baby. So you must consider this parameter. Also you need to consider the pharmacokinetic parameter that we have seen just now. Okay, so the prescribing in case of pregnancy, it must be balanced between the risk of adverse effect on the fetus and also the risk of leaving maternal disease untreated. What it means, so only due to the effect that is produced on the fetus, you cannot ignore the mother who is suffering from the disease, isn't it? Because overall health of the fetus, it is also depend on the health of the mother. So if you are not treating the mother, if she is suffering from the disease only due to the reason that the fetus get affected or the drug produce teratogenic effect, then in that case you need to really balance the aspect. You see where is more risk, whether the fetus is at more risk or mother is at more risk, right? So accordingly you need to calculate the risk and the benefit ratio, and you need to balance this, and based on that, as a physician you can prescribe medicine to the pregnant woman. Likewise, as a pharmacist, when prescription come to you, you can also further summarize that drug. You can look into these aspects and see whether that drug can be dispensed to the patient or cannot be dispensed to the patient, or you need to change the prescription after having the good conversation with the physician. Okay, so overall prescribing in the pregnancy, it must be balanced between the risk of adverse effect on the fetus and the risk of leaving maternal disease untreated. Okay, so this is one parameter. Second thing is that the effect on the fetus. So whenever you are giving medicine to the mother, so you must also consider the effect on the human fetus. So in most of the time, the effect on the human fetus, it is not possible to predict from the animal experiment, because we know that in case of pregnancy, it is not ethically allowed to conduct the clinical trial. So there is limitation that you need to study the drug on the animals. That is only the option, because human being you cannot conduct clinical trials on the pregnant woman. But in such case, the effect on the human fetus, it is always not possible to predict from the animal experiment, because in many cases when drug that show bad effect in case of the animal does not show that's the similar effect or the similar intensity of adverse effect in case of the human being. Likewise, drug sometimes was safe in animals was not safe in case of pregnant women. So always animal data cannot be correlated with the human physiology or with the pregnant woman. So that is another challenge while investigating or inventing the new therapeutic option for the pregnant woman. In addition to this, untreated maternal disease, suppose if you just look into the fetus, about the fetus health, and you think that if medicine it is given to the mother, then that may affect the fetus, and in such case if you have not treated the mother, then this untreated maternal disease it may cause morbidity, or sometimes it may also lead to mortality to the mother as well as the fetus. So just looking at the safety of fetus it is not enough. You need to really look into the safety of both fetus as well as the mother. So in some time or in case of unfortunate condition, you need to take certain decision based on balancing the benefit to the mother as well as the fetus. Okay, so this is the another aspect that physician as well as pharmacists must consider while giving medicine to the patient. In addition to this, the overall thing that you must keep into your mind is the physician must prescribe minimum drug as far as possible. So minimize prescribing, it is the one of the best way to in case of the pregnancy. So whichever drug which are very essential can be given to the mother. All those non-essential drugs which are not mandatory for during that 9 months of the pregnancy must be avoided to avoid any bad effect into the fetus. Okay, so minimize the prescribing could be the good option, but always not a practical option. Okay, in addition to that, you can use the tried and tested drug instead of giving the drugs which is the new or which is the drug come first time into the market where data is not available. That drug you don't use. Instead of that, you can use the tried and tested drugs for which significant data it is available in the different the data bank or the different the books which are generally used to give information about the drug which is to be given to the pregnant woman. Okay, so the tried and tested drug can be used. The smallest possible effective dose must be started with. So whenever you are giving the treatment to pregnant women, you must start with the smallest possible dose, and then slowly you can increase the dose based on the need of the patient. Okay, so whenever you are starting the treatment in case of pregnant women, you must be very cautious while giving the dose, while giving the drug, or while giving the complete pharmacotherapy to the pregnant woman. Okay, so you must remember that. So this is what you are doing, or this is what you use while prescribing the medicine. But in addition to that, you must remember that the fetus it is most sensitive in a first trimester. We have seen in first trimester what are those stages. In first trimester are the first stage, that is the fertilization. Second stage it is the organogenesis which occur between something up to the fourth week, and third stage that is fetogenesis that is also come in the first trimester. Okay, so the fetus it is most sensitive in the first trimester. So during the first third month of the pregnancy, so that is called as the trimester, you must avoid the medicine to the pregnant woman. You must give only essential medicine to the woman wherever required. Okay, because fetus is most sensitive in the first trimester of the pregnancy. In addition to that, you must consider pregnancy in all women of childbearing age, because sometimes pregnant woman she comes to the physician and she is not aware that she is suffering from the pregnancy or she having the pregnancy, isn't it? So in those cases whenever you are giving medicine to the woman, if she is a married one, then in that case you must always consider that she is the child-bearing woman. She has the potential to give the birth to the child and become a pregnant. Then in such case, before giving any medicine, you see that or you confirm that that woman is not a pregnant one. Okay, so you can ask few questions and identify physiological symptoms which are related to the pregnancy, or you can conduct simply the pregnancy test. Nowadays Prega News and many strips are available which give you an instant result and show you whether that woman is pregnant or not. Okay, so generally it can be done at physician level. I know it will not be so practical at the pharmacist level, but this can be done to avoid any risk to the growing child or growing fetus in the mother womb. Okay, so you must consider this. In addition to that, as a pharmacist, as a physician, you can seek guidance from the British National Formulary. So I will suggest you to go into the Google and just type British National Formulary. You will get significant data about the drugs which are to be given to the pregnant woman, or what precaution it is to be given to the pregnant woman, because it is very vast field, and the people they do the doctory in this field. So that is why the specialist doctors are available, or physicians are available. They are called as the gynecologists. So they are specialists in this. So within 2 hours I cannot cover all the aspects. So if you want to study that in detail, you can go and refer the British National Formulary, and there you can just search for the drug for the pregnant woman or the teratogenic drug. You will get good amount of information. Likewise, another database, it is the Drug Information Service, where also you will get good amount of information about the medicine that is given to the pregnant woman. And lastly, the National Teratology Information Service will give you good information about all those drugs which produces the teratogenic effect in case of the fetus. Okay, so these are the different way or the database that you can refer if you are not aware of the new medicines, to just check out what could be its effect in case of pregnant women or on the growing fetus in the mother womb. Okay, so these are different practical aspects. In addition to that, you can discuss potential risk of taking or withholding the therapy. Like suppose if mother is the pregnant, then in order to safeguard the fetus growing in the mother womb, if you stop or withhold the therapy, then you must calculate what is that potential risk of not giving medicine to the mother. Okay, so that can be discussed. If you are not a specialist, you can have the discussion with someone who having good experience about giving medicine to the pregnant woman. So that can be discussed. Warn the patient about the risk of smoking and alcohol, because we have seen that in last lecture the smoking and alcohol produces harmful effect in the fetus. You must also warn patient about OTC drug. Sometimes patients are habituated to go on the medical shop and take over the counter medicine. That is very bad behavior, that should not be done. And if she is going to medical shop taking the medicine, she must inform to the pharmacist that she is the pregnant woman. Okay, then he will be cautious and he will give the medicine which may not produce the bad effect in the pregnant woman. So OTC drug, you must warn the patient about the risk of those drugs. Likewise, you must explain about the drug abuse. If pregnant woman, if she is the addict to the particular drug like the cocaine, heroin, that is quite common in case of Western country, then in those cases you need to warn that patient about the risk to the growing fetus in the mother womb. So I have done with my first part of today's session. So let's move on to the next part of today's session. It is the recognition of teratogenic drugs. So there are two, or the principal problems are there in deciding the teratogenicity of the drug. The one most important problem is that you cannot conduct clinical trials in a pregnant woman. Since you cannot conduct clinical trials in the pregnant woman, you need to rely on the study from the animal models. Okay, so the many drug, they produces the birth defect when given to the pregnant animal, but when it is given to the human being, it was observed that it does not produces the similar effect. What it means? It means that when the drug produces the birth defect in a pregnant animal, it doesn't mean that they are teratogenic in human at therapeutic dose. So that doesn't reflect on the human model, or sometimes it reflects and sometimes it doesn't reflect, right? So any drug, if it produces teratogenic effect in the pregnant animal, it doesn't mean that those drugs are teratogenic also in case of the human being. So this is one of the problem, and ethical reason you cannot conduct clinical trial in case of the pregnant woman. Okay. Second thing is that the sometime the effect on the fetus, it may take several years to become clinical manifest. So to clinically manifest that effect, it takes several years, and you will be surprised to know about the case study that I am going to present you now. Okay, so just you look at this case study where diethylstilbestrol, it is used late in 1940 to prevent miscarriage and preterm birth. Okay, so to prevent miscarriage and preterm birth in 1940, diethylstilbestrol was used. But during that period, it was observed that diethylstilbestrol was very safe drug. Due to that reason only, it was given to the pregnant woman. But then after study was continued, and it was observed that there is good relationship between the diethylstilbestrol treatment given to the mother and adenocarcinoma of vagina that is happened to the girl in their late teen, whose mother had been given with diethylstilbestrol during the pregnancy. Now can you imagine, the drug was given in 1940, and when relationship was established, the relationship was established in 1971, almost 31 years after that. So mother took the medicine, and when the girl reached to their late teen, the late teen means almost after 20 to 25 years of the age, when she reached to that particular age, she had adenocarcinoma. And then when study was done, it was observed that this adenocarcinoma which was happened to the girls, it was due to the reason that their mother had given with diethylstilbestrol during the pregnancy. Now there could be many such example, but it remains unrecognized. So when this was coming to the picture, there was a retrospective study where they go and look back into the history. They have identified all those mothers who have been given with diethylstilbestrol. They have checked database, and they have seen all those female child, when they reach into their adulthood, they will suffer from adenocarcinoma, or most of them will suffer from adenocarcinoma. So this is how this adverse effect was traced back. So likewise, there could be many drug, it may produces the long term effect, or that could not be possible to trace back. So that could may also be possible. So this is also the major problem while recognizing the drug which is called as teratogenic in nature. So as a pharmacist and as a physician, you must have good database so that you can ensure that the safe drug it is given to the pregnant woman. So to have this database, there is 5-point system of classification, that is ABCDX system of classification of teratogenic drug. It is available and used by FDA. Okay, so the FDA has categorized these drugs by using ABCDX system of the classification. So if you know that the drug belongs to the category A, B, C, D, X, if that is the case, every drug having particular attributes. As you are moving on from A to X, right, there is increase in risk of giving drug to the pregnant woman. What it means, the A, the category of the drugs are most safe in pregnant women, B are less safe as compared to A, C are less safe as compared to B, D are, these are the least safe drug, and X are the drugs which are very dangerous if you are giving this drug to the pregnant woman, and it produces having the more risk. So all these drugs belong to the category X are the contraindicated in pregnant women, right? Likewise, there is increase in severity of ADR in pregnant women when you move from drug A to drug A to drug X system of the or the category of the drug. Okay, so let's see what are those drugs which are category A. So the category A are the drugs when they were studied, the study failed to demonstrate a risk to the fetus in the first trimester. Since there is no risk to the fetus in first trimester, based on the evidences, what it means, these drugs are safe in case of the first trimester. Likewise, there were no evidence of risk were observed in the last trimester. So overall, these drugs, since they doesn't produce any effect even in first trimester of the pregnancy and also in case of the last trimester of the pregnancy, these drugs are considered as the safe to use in case of pregnant women. Or category A drugs are those drugs which are most safe to use in case of pregnant women. Okay, so these are the category A drugs. Let's see few examples like the vitamins and levothyroxines are the safer category of the drug for the pregnant woman. So this is the category A. Category B, these are the drugs when they were studied on the animal studies show no fetal risk. So in animal study, no fetal risk. In the human study, which is the control study, also there is no risk to the pregnant woman. So animal also no risk, and in case of human study, there was also no risk of giving this drug was observed in case of the patient. Okay. Likewise, when animals sometimes animal studies show a risk to the fetus, but it was not confirmed in the control study in the pregnant woman in the first trimester of the pregnancy, and also there is no evidence of the risk in the late trimester of the pregnancy. So in both cases, animal studies show the risk, but here there is no confirmation in case of pregnant women, both in case of the first trimester as well as the last trimester of the pregnancy. What it means, again, these drugs of this class are the safe to use in case of pregnant women. So both category A and category B drugs are safe to use in case of pregnant women. Let's see the example. Example, it is acetaminophen, antibiotic like the amoxicillin. So they are doing the MOX, which is prescribed to the pregnant woman because the amoxicillin it is safe in case of pregnant women. Okay, so these are the category B drugs. So to summarize, category A and category B drugs are safe to give in case of pregnant women. Category C are those drugs when you conduct the animal study. In animal study, it reveal adverse effect on the fetus. So since it reveal adverse effect in the fetus, and when the control study was conducted, it was observed that there are no adverse effect, or even data is not available. Since data it is not available on the control study in the woman or study in women are not available, due to this reason, these are the drugs which having the little risk because data on pregnant women is not available. So drug from this category can be given to pregnant women if the benefit to the mother it outweigh the risk to the fetus. It means since no data is available, you must be very cautious. If the benefit to the mother it is more as compared to risk to the fetus, then only you can give those category of the drug, or you can only give when the drugs are absolutely necessary. For example, the diltiazem, it is the drug belong to the category C, and spironolactone, it is another drug which belong to the category C drug. Fourth category, it is category D drug. So in fourth category, it was observed that there is evidences of the human fetal risk are available, but also the benefit to the mother can be accepted despite risk to the fetus. Because if you are not giving medicine to the mother, then in that case, it may create problem to both the mother as well as fetus. What it means, there is more benefit to the mother as compared to the risk that is happening to the fetus. So the drug in this class may be used in case of the pregnancy. Again, like the category C drug, if benefit to the mother, it outweigh the risk to the fetus. It means both category C and D drugs are only given after calculating the risk and benefit ratio. the benefit to the mother should be more as compared to the risk to the fetus, then only you can give this medicine. So it can be used in case of the serious diseases where other safer alternative drugs are not efficacious. Example like the phenytoins and valproic acid, it belongs to the category of category D drug. Okay. The last category is the category X drugs where animal or the human study have demonstrated teratogenic effect in those patients. Since there is clear-cut teratogenic effect, it is demonstrated, the risk to the fetus, it clearly outweigh any benefit to the mother. It means the risk it is more to the fetus as compared to benefit to the mother. So all these category of the drug are contraindicated in case of pregnant women. Okay. Example of the drugs, it is thalidomide and warfarin. These are the drugs which are contraindicated. So to summarize, category A and category B drugs are safe to be given in case of pregnant women. Category C and category D having little risk. So these are the drug can only be given when the benefit to the mother is more as compared to the risk to the fetus. Category X, these are the drugs which having the clearly defined teratogenic effect both in animals and human study. So these drugs must be contraindicated and should not be given at any case to the pregnant woman like thalidomide and warfarin. So I have done with my today's session. I have referred these textbooks to gather the information of my slide deck. I must thank the author of this textbook for giving the wonderful information on the chapter of the special population with reference to the effect of drug in pregnant women. Thanks for watching my session. For more such learning, subscribe to my channel. If you like my session, then do remember to give me a thumbs up. And also, if you have any doubt, any question, even after my session, you are free to write that in the chat box. I am more than happy to give your answer.